Meet Beverly, a married mother in her early 40s whose life has been overshadowed by recurring health issues. Friendly and open, Beverly shares her struggles with chronic cystitis, sinus congestion, and emotional scars from childhood trauma. Her story is not just about physical symptoms, but also about the emotional burdens she carries. As we follow her journey, we'll see how homeopathy offered her a path to healing when conventional medicine could not. Let's begin by understanding Beverly's initial complaints and the impact these issues had on her daily life. Beverly's main physical complaint was recurring cystitis, or bladder infections, which had troubled her for years. These infections often followed intercourse, causing burning sensations, spasms, and frequent urination. Despite extensive medical workups, including the discovery of 2 ureters on her left side, doctors found no clear cause. Antibiotics provided temporary relief, but the problem persisted, always lurking in the back of her mind and affecting her intimate life. This chronic issue was more than just a physical ailment. It weighed heavily on her emotional well-being. In addition to cystitis, Beverly suffered from severe sinus congestion, especially during wet or rainy weather. Her nose would block completely, making it hard to breathe, and she often woke up with clear mucus. She also experienced sharp pain in her left ovary area, which shifted from mid-cycle to just before her period. These physical symptoms added layers of discomfort to her life, making her daily routine even more challenging. Understanding the full scope of Beverly's symptoms was crucial for her holistic treatment. Beverly's emotional landscape was shaped by a traumatic childhood. She revealed that she had been sexually abused from a young age, an experience that left deep emotional scars. This trauma contributed to her feelings of self-reproach, sorrow, and a persistent sense of abandonment. Beverly often felt alone, believing she could rely only on herself. These emotional wounds were intertwined with her physical symptoms, highlighting the need for a treatment approach that addressed both her body and her mind. Beverly described herself as friendly yet introverted, someone who prefers not to be noticed. She struggled with shyness and found it hard to introduce herself. She was honest, but easily depressed, often feeling criticized by an internal committee of voices. Beverly feared being restrained or abandoned, and she sometimes dreamed of being left alone. Her childhood was marked by a controlling mother and a loving, creative father who was unaware of her suffering. These personality traits and fears played a significant role in her overall health picture. Beverly's physical constitution included being chilly with cold hands and feet, yet she preferred open windows and fresh air. She slept on her abdomen with her hands underneath her, and occasionally put her warm feet out of the covers, even in winter. Her period began at age 11, and regular exercise helped prevent premenstrual symptoms. She enjoyed rich foods like chocolate, ice cream, and starchy dishes. These details, while seemingly minor, were important clues in selecting the right homeopathic remedy. The homeopath assessed Beverly's case by considering both her physical and emotional symptoms. Her recurring cystitis, sinus congestion, and ovarian pain were noted, but so were her emotional wounds and personality traits. The homeopath recognized that Beverly's healing required addressing her as a whole person, not just treating isolated symptoms. After careful consideration, the remedy Staphysagria was chosen, as it is often indicated for patients with a history of sexual abuse and recurring cystitis. Beverly's initial treatment plan involved a single high dose of Staphysagria. This remedy is commonly used for emotional trauma and cystitis, especially when linked to past abuse. However, after 1 month, Beverly reported little improvement. She still experienced cystitis, ongoing stress, and unchanged sinus symptoms. Her emotional state remained low, with increased introversion and fatigue. The homeopath decided to try a lower potency of Staphysagria, given daily, hoping for a better response. Despite the adjusted dosage, Beverly's symptoms persisted. She developed a yeast infection, experienced severe foot cramps, and her period arrived early. Her anxiety and stress levels remained high, and her sinus congestion and ovarian pain continued. Beverly expressed doubt about the remedy's effectiveness, but remained patient, understanding that chronic issues often require time to resolve. The homeopath recognized that a new approach was needed and decided to discontinue Staphysagria. With limited progress from Staphysagria, the homeopath prescribed Pulsatilla, a remedy known for its effectiveness in gentle, yielding personalities with emotional sensitivity and physical symptoms like Beverly's. Pulsatilla was given in a low daily dose, marking a new phase in Beverly's treatment. The hope was that this remedy would address her unique combination of physical and emotional complaints, offering a more holistic path to healing. After starting Pulsatilla, Beverly experienced significant improvements. She had no episodes of cystitis and was able to stop taking antibiotics after intercourse. Her cramps disappeared, and her sinus congestion improved noticeably. Although she still had some ovarian pain, her overall energy and emotional state were much better. Beverly began communicating more with her husband, and their relationship improved. For the first time in years, she felt hopeful and empowered. During this period, Beverly began having vivid dreams, often with themes of danger or abandonment. One dream, which previously would have left her in tears, ended with a humorous twist, signaling a shift in her emotional processing. These dreams reflected her inner healing as she started to resolve long-standing emotional issues. The improvement in her dream state paralleled her growing sense of well-being in daily life. At her fourth follow-up, Beverly reported the longest stretch without a bladder infection in her adult life. Her nose still got stuffy at times, but overall, her symptoms were much improved. She had no more cramps, and her marriage continued to thrive. The homeopath increased the potency of Pulsatilla, confident in Beverly's ongoing progress. This stage marked a turning point as Beverly's health stabilized and her confidence grew. Despite her remarkable progress, Beverly experienced a few minor spasms that she managed with cranberry juice. However, she had no full-blown bladder infections, and her emotional and physical health remained strong. Her only lingering issue was some nasal stuffiness in the evenings. These minor setbacks did not overshadow her overall improvement, and her homeopath prescribed a higher potency of Pulsatilla to support her continued healing. By the 10th month, Beverly was thriving. She had no cystitis, her nose was much better, and she felt emotionally balanced. Her energy was high, and she began volunteering at a spiritual center, reflecting her renewed sense of purpose. The homeopath decided that no further medication was needed, and Beverly was advised to follow up only as necessary. Her journey from chronic illness to vibrant health was nearly complete. Beverly's case illustrates the core principle of homeopathy, treating the whole person, not just the disease. Her recovery involved not only the resolution of physical symptoms, but also a profound emotional transformation. The right remedy, Pulsatilla, was chosen based on her unique personality, emotional history, and physical traits. This individualized approach allowed her to experience healing on all levels, demonstrating the power of holistic medicine. Pulsatilla was not a specific cure for cystitis, but it matched Beverly's overall constitution. Her mild, timid nature, desire for open air, chilliness with hot feet, and specific food cravings all pointed to this remedy. The success of Pulsatilla in Beverly's case highlights the importance of matching the remedy to the person rather than just the disease. This approach led to lasting improvements in both her physical and emotional health. For years, conventional medicine could only offer Beverly temporary relief through antibiotics and repeated tests. Despite sophisticated medical workups, her chronic infections persisted. It was only through homeopathy, which addressed her as a whole person, that Beverly found lasting relief. This case underscores the limitations of treating symptoms in isolation and the value of a holistic approach. An important aspect of Beverly's recovery was the resolution of her emotional trauma. The homeopathic remedy not only improved her physical health, but also helped her process deep-seated sorrow and abandonment. Her vivid dreams served as a window into her healing journey, reflecting the integration of emotional and physical well-being. This mind-body connection is a hallmark of successful homeopathic treatment. Beverly's case also demonstrates the importance of dosing and potency in homeopathy. Her remedies were adjusted over time, with potencies gradually increased as her health improved. This gentle, stepwise approach allowed her body to heal at its own pace, minimizing side effects and supporting long-term wellness. The wisdom of the body was respected throughout, with the most important organs healing first. Beverly's story is a testament to the power of openness and self-reflection in healing. By candidly sharing her personal history and emotional struggles, she provided the clues needed for a true cure. Her journey reminds us that healing the person, not just the disease, is at the heart of homeopathy. Beverly's recovery offers hope to others facing chronic illness and emotional pain, showing that lasting wellness is possible when the whole person is treated with compassion and understanding.